is the narrated version of Chapter 9, Sexual Asphyxia. Sexual asphyxia is the consensual or forced reduction of oxygen to the brain to enhance physical or psychological pleasure and associated with sexual arousal. Autoerotic asphyxia refers to the deliberate induction of hypoxia with the intent of causing heightened sexual arousal. Sexual asphyxia can be practiced both as an autoerotic activity and as a consensual sadomasochistic act between two or more people. When consensual sexual asphyxia results in death, the death is unintended. Acts of non-consensual sexual asphyxia would be for the needs of the person restricting the other person's oxygen and are best described as an intentional criminal act. Unintended death and intentional criminal act can be difficult to discriminate in some circumstances. Drug or alcohol use and/or abuse may add another layer of confusion. The true extent of sexual asphyxia is unknown. The majority of cases come to light due to the death of the practitioner. There is no typical predominant profile of someone who engages in any kind of sexual asphyxia. It is practiced by both sexes and to have been practiced in many cultures for hundreds of years. Death scenes will vary, but certain findings can be expected. To form an opinion that a death is the result of autoerotic asphyxia, the investigator would need to find evidence that 1. The activity was repetitive, and 2. The activity was likely pursued for sexual stimulation. There should be evidence that the death was not an expected outcome. Examples could be padding between the ligature and the neck and escape mechanisms. The following death scene findings are necessary to determine that a death is due to autoerotic asphyxia. Number 1, there is an expectation of privacy. Number 2, there is no convincing evidence of suicidal intent. Number 3, there is no evidence of another actor at the scene. Number 4, there's an apparatus to induce hypoxia. Number 5, the apparatus includes an escape mechanism. Number 6, the victim could have placed any bindings found. Specific autopsy findings will vary depending on the actual manner and mode of death. While the cause of death may be autoerotic asphyxiation, the manner of death may vary because of the use of ligature or some other hypoxia-inducing apparatus. Although it is mostly a male activity, women do engage in sexual asphyxia. Female autoerotic death scenes do not present the same as male autoerotic death scenes. According to Bird, in 1990, male age range 9 to 80, female age range 19 to 68. Male death scene characteristics by the presence of pornography, unusual attire, devices to cause pain, props, and evidence of fetishism. When confronted with a possible autoerotic death scene, the following factors may be helpful in making a determination of autoerotic asphyxia death. Number 1, was there a reasonable expectation of privacy? Number 2, were doors or windows locked from the inside? Number 3, was it possible for the victim to place whatever ligatures are present on himself or herself? Number 4, if a non-ligature method of asphyxiation was utilized, was it possible for the victim to engage in it by himself or herself? Number 5, was the padding on ligatures to prevent visible marks? Number 6, was there evidence of fantasy or fetishistic activity? Number 7, was there evidence the behavior had occurred before? Number 8, is there a lack of evidence that the victim committed suicide? And number 9, are any of the injuries at the scene attributed to motion of the victim after losing consciousness? This is the end of this narrated PowerPoint.